Hi, I'm Lior. I'm the National Manager of Supporting Housing Services in Enosh. Enosh is the Israeli Mental Health Association. It's the largest community-based mental health organization in Israel. We provide services in areas of supportive housing, supportive employment, social skills, and youth and family counseling centers. Our main goal is to support social inclusion and rights of people with psychosocial disabilities and their families. The outbreak of COVID-19 has interfered with the routine, the social interaction, the recovery process of our service users. At first, housing programs were still operating at the time of the COVID while other programs were stopped, but with modifications. And for example, at routine, we go to our service users' houses or practice with them consuming of services in the community. What we cannot do during the COVID. Another challenge was that in the stage, at the beginning, it was more mental health support, taking care of physical and emotional needs, and less recovery. And another challenge was to help our service users to cope the uncertainty, and for some of them, the loneliness they experienced. So at the beginning, we were operating by the emergency organization and the Ministry of Health guidelines. While meantime, we were scanning the service user needs and help them to cope with the uncertainties they experience. We developed an online remote communication. We have received a generous donation of smartphones from one of the largest mobile companies in Israel, and we, of course, handed out to people who didn't have one. We distribute conversation protocol to our teams. We were able to reach more people in the peripheral region of Israel, and we had some groups that could be national and not just regional. It was very interesting to see. And where it was needed, we provided a face-to-face services according to the health restriction, of course. We were working around the clock to ensure hygiene and sanitation equipment, food, medicine. I can say that most of this work was done by our amazing teams members that went from house to house, buying food, baskets, buying medicine, take go to the pharmacy and go back to the houses. They were really working really hard in days that most of people didn't go out of the house. And we have a great example for peer support. One of our service users, Ze'ev, decided he wanted to volunteer during the COVID. So he took his bike and just went around town and buy medicine for people that couldn't go out of the houses and give them to them. I think that one of the things that helps us most is being an agile organization. What gave us the ability to be very flexible in a short period of time and to change our services every day if needed, according to the needs of our service users and the Ministry of Health guidelines. Another thing was the coordinating work we were doing during time of routine. And it was very important in time of crisis. We see that there was a good communication between the management and the field, the management and the professionals and service users. And another thing that we put a lot of effort to deliver a unified message to the field, especially in situation of uncertainty. We understand that it's important to people to have some certainty, and we work about it really hard. We had an opening Zoom session every day with the management, and it helped us to be unified as us.